Investigations that are being related to a patient in which we are suspecting that he or she might be suffering from hydrocephalus, first of all, have to be diagnostic in their overall quality. For instance, we want to particularly definitively diagnose that the patient is suffering from hydrocephalus. Now, for that, we can have skull X-rays as well. Which is usually an obsolete phenomena, but we might basically suspect the fact that over here you can even observe in this particular patient that there is this sutures that are being parted due to the fact that there is an increased intracranial pressure, and this is again one of the easiest tool to diagnose that there is an increased intracranial pressure in the patient. So this can be one of the ways in which we are basically diagnosing that there is an increased intracranial pressure. Moving on, we can also move on with lumbar puncture in the patient. What we are basically expecting, we usually perform the lumbar puncture at the lower border of the L4 and 5 in the neonates. This is the normal level at which the spinal cord ends in the neonates. So we're going to perform the lumbar puncture for these particular patients, and we are going to take out the CSF and send it for the histopathological examination, just to rule out the fact that either the patient is suffering from any kind of an infectious state, which is basically leading to this particular increase in the intracranial pressure, or not. So it can be an encephalitis, it can be a meningitis, specifically a pyogenic meningitis, which was one of the leading cause of the acquired conditions leading to a hydrocephalic condition in the child or even in the adults. So we can rule that out by carrying out a lumbar puncture in the particular patients. Now, cranial ultrasounds are also being carried out, and again, they're just going to focus on the fact that what is basically the size of the ventricles, particularly the lateral ventricles. And obviously, it can also focus on the rate of production of the CSF in the ventricles as well. So this is what we're going to focus on in the cranial ultrasounds. The normal rate of production of the CSF in the lateral ventricles is almost 0.2 to 0.3 ml that is being produced in almost per second. So this is going to be the normal production of the CSF. If it's exceeding this particular phenomena, again, it's going to be problematic and pathogenic for the patient. Now, the brain scan using the different radioisotopes are being carried out, and again, we are going to focus on the size of the ventricles, which is again indicative of the fact that either the patient has some sort of increased intracranial pressure or not. So here you can observe the fact that there is an size increase in the lateral ventricles that is noted down, and the back pressures can also be noted down over here. As we can see that there is a back pressure over here, and the fluid is being accumulated over here due to some sort of an abnormality or a communication problem with the third ventricle at the foramen of Monro. So even the site at which the problem is arising can be detected when we carry out these radioisotopic techniques in the patient. Then, as we said, that the arteriovenous malformations, which are basically leading to aneurysms and an aneurysmal rupture, can obviously lead to hemorrhagic condition. So to diagnose any kind of the AV malformation or any kind of an aneurysm that is present in the patient, we can carry out the arteriographies, and that are again suggestive of the fact that if there is any kind of a congenital AV malformation, if it is present in the patient or not. Then moving on, we have the head CT scans that are being done for the patient. And again, the CT scans are focusing on the sizes of the ventricles, and they are being compared with the normalcy. And you can basically diagnose that an increased size of any of the ventricles, particularly we are focusing on the lateral ventricles, and that's quite easy to diagnose whenever there is a size increase in the lateral ventricles particularly. Then we have the echoencephalographies, that is the EEGs that can be carried out. These brain waves are again indicative of a normal functioning of the brain. So any kind of a seizural activity can be even noted down when we carry out these echoencephalographic techniques and we look at the brain waves, we can detect any kind of a seizural activity as well. In neonates, when they come up to you, even with normal visits, not exhibiting any other signs, we have to start off with the occipitofrontal circumference measurements. The growth charts are always present for that particular area in which you are practicing clinically, and you can basically start off comparing the head circumference, and if there is an increased growth rate of the head circumference in the child, it is again indicative of the fact that he or she might be suffering from hydrocephalus, and obviously you're going to rely on the other factors and or the other investigative techniques, and all of the clinical picture has to be present in the patient to diagnose him. And you cannot basically solely depend on a single clinical evaluation of the individual. You have to repeatedly call the individual, and you have to even educate the patients to look for the signs and symptoms of the hydrocephalus in the patient as well.